Hi, I'm Karen Whitaker, student at Walden University, and I'm going to be doing the eye exam. I have my patient from the previous exams that we've done. Before I start her exam, I'm going to talk about the Snellen chart, and I am going to discuss the confrontation test. Now, the Snellen acuity chart, I don't have one. It's used for the screening of visual acuity. You can use it with any age person. It's an alphabet, and what you do with it is it's a standard eye test. You use standardized numbers or alphabets, and it's recorded 10 to 20 feet from the chart. So the person has to be standing 10 to 20 feet from the chart. The person will begin to read the numbers that are the smallest up until the numbers that they're most comfortable with. Okay, the standard normal vision is 20/20. Okay, and if you have a measurement other than 20/20, then it could possibly mean that you may need glasses, or you may need some assistive device to help you to read. The other test that we have is the confrontation test, and that particular test it assists with visual acuity as well. Let's see. Actually, what we could do with the confrontation test is, my back is going to be to the camera, but the patient would have to cover either the right or left eye. So if the patient covers the left eye, then I cover my right eye, and then, so see if you can cover your left eye. I'll cover my right eye, and then I'll take my hand and bring it towards the patient, and the patient will tell me just exactly when they see my finger. So that's how you would perform the confrontation test. Now, I'm going to be looking at the patient. I'm going to be looking at her face again, looking for symmetry, looking for any trauma, any signs and symptoms of infection, dryness, any lesions, any skin deformities around the eyes, which I don't see any. I'm going to be looking for the moisture in my back. She can hardly see. I'm going to be looking at her conjunctiva. If you can look up for me, move your eyes around for me. I'm looking to see if they're moist, if they're dry. She's able to move her eyeballs around without any issue. Can you blink your eyes for me? I don't see any involuntary movements of the eye. Okay. Let's see. Let's see. Turn the lights on. I'm going to be looking in her eye. Okay. Do you have, if you were to cry, would that be okay? I mean, you have tears. You have tears. Okay. And I'm looking at her eyebrows. That's symmetrical again. I've looked at the conjunctiva. There's no scarring. I just want to take a look into her eye. Looking at her retina, side to side. I would also want to look at if she can follow without any difficulties. I also want to do the corneal reflex, which would take a Q-tip and swab her eye don't know how that would feel in dry eyes. But um, let's see. I would want to look at Perla. If the room was darker and I flashed a light in her eye, would the pupils change in size? We're looking at her retina for color. I think that's it. I think we've covered the entire eye exam.